Good morning, everybody. Just give me a second to get the attention of everybody in the room here. Thank you very much. Welcome back to the seminar. Sarah Henderson coming to you from the other side of things today. And I am very happy to introduce friends and colleagues from the University of the Fraser Valley and from the University of British Columbia. Dr. Michelle Riedlinger worked in Australia for 15 years as a science communication researcher and consultant with the University of Queensland and EcoConnect Communications. Her main areas of research interest are the communication of environmental science, controversy, and risk. She moved to Canada in 2010 and is working at the University of the Fraser Valley in the communications department. Before coming to UBC as an associate chair in arts studies and research and writing, Dr. Jacqueline Rhea taught a range of courses at Brock University, including courses on academic writing, rhetorical theory, and discourse analysis. Between 2004 and 2006, she was the director of Brock's writing program called Writing, Rhetoric, and Discourse Studies. Her areas of interest include language ideologies, new rhetorical genre theory, and non-literary stylistics. Maybe she'll tell us what those things mean. Anyhow, thank you very much for joining us this morning, ladies, and we're really looking forward to your presentation.
Okay, so as you can see from our title slide and from the blurb for this presentation, we're looking at radiation risk from the Fukushima nuclear incident and what we and how it was communicated on the internet in Canada and what we can learn from it. An essential element for mobilising. Am I on? Great. For mobilising, mobilising action by members of the community. So that they can take appropriate precautions and minimise their exposure to potential harms. Sarah talked about that in her presentation on heat events last week, the importance of early warning and communication. But with the growing reliance on the internet as a source of communication, people are becoming increasingly capable of creating their own networks and sharing information that may or may not be accurate or helpful. Social networking, online journalism, blogging, they encourage a participatory model of communication that could really improve the quality of information being shared and even contribute to community action to help gather data or participate in activities to help minimise harm. But if the online Canadian response to the Fukushima incident is an indication of what we would see with a future incident that is perhaps closer to home, then there's evidence that Canada's building, the capacity for, building any sort of participatory online citizen involvement in risk assessment, communication, or management of these issues. There's not much evidence of it. So in this seminar, we'll be taking you through how we came to that assessment and also what we might take away from that. So as an outline, what we're going to do in this presentation, we're going to start looking at existing reports. We're not the first people to look at lessons learnt from Fukushima, so we're going to look at what's been said out there already. Science communication and new media, just a bit of the theory, the ongoing stuff that's happening and what researchers have said recently. Our study looking at Fukushima and radiation risk in Canada on the internet. I'll be looking at mapping that internet communication, which is very messy. And then Jackie will be talking about characteristic wordings and structures and maybe some of those elements that you introduced at the beginning. And then we'll look at implications, so lessons, what we can learn from this. So if you're all with me, let's go. Okay, so as I said, we're not the first people to think about lessons to be learned. The UK Office for Nuclear Regulation, they looked at lessons for the nuclear industry in the UK. The US are in a big process at the moment looking at lessons learnt from Fukushima for their own regulatory process. The International Atomic Energy Association have developed an action plan based on the lessons they learnt or the assessment they did of Fukushima. MIT, technical lessons learnt from Fukushima. Greenpeace, lessons from Fukushima. Lots of people have been looking at lessons. And closer to home, the report from the External Advisory Committee, Canadian Nuclear Safety Commission, looking at what we can learn from this incident. Health Canada also produced a report on lessons learnt This was in December 2011, but it's not been available to the public so far. It's actually been cited in the Canadian Nuclear Safety Commission report, so that's pretty much what I've gleaned from it based on that. So key themes, what can we take away from those reports? Well, a lot of the focus of these reports is on safety standards and assessments, not surprisingly. So the regulations and controls, emergency preparedness and response, internationally as well as nationally for countries, legal aspects and liability, what it means for people perhaps affected who are close by these incidents. In terms of communication, the focus is on international and inter-organisational communication. So how we can get information quicker that'll help countries make assessments for their own programs. Very little on public communication in general. What we do see is, and not much on internet communication. I'll talk a bit about what we do see. Yeah, but it's rarely mentioned. It's one of those things where it's said in these reports, it's really important, public communications and information's really important, but in terms of lessons learned, it's pretty much we need to be doing more and better of it, yeah, which is pretty general. So, so getting down to some of the specifics, the International Atomic Energy Association, they had a bit of a conference based on communication and nuclear emergency, and their chair said, I want to stress that crisis communication can only work properly as part of a comprehensive management, the comprehensive management of nuclear safety, involving the general public, looking at this whole idea of, transparency, independence, but that's about as specific as we get in terms of a communication action we can take away. MIT go the other way and they focus on the message. So this sort of thing about how do we communicate to the media? What's the silver bullet message that's going to calm people down about this? So they felt that there was a lot of confusion over this use of 3 different scientific quantities, the use of 2 systems of units, SI, and then older units still in the US. So the lack of context for understanding the meaning of radiation levels. So it's much more focused on the message, but still the what and the how, we don't get a sense of that, how you actually communicate that. Closer to home again, the Canadian Nuclear Safety Commission, they recommend that the CNSC develop a comprehensive communication and education strategy that includes social media, so involves social media. I think there was a couple of tweets from Health Canada, and not much. There's some web-based communication from these guys. I can talk about that. But involving science, media organisations, and having the ability to inform the public. So again, very general in terms of what we can do for the future. So, yeah, so as I said, the how as well as the what is something that I'd really like to explore. And I think we can do that by looking at some of the recent work that's some of the recent work to do with communicating complex information and the internet. Researchers have been looking at that. So there was 2 months ago, Science, there was an article that came out by Brassard and Schufeller. Apologies if somebody has that last name and I'm saying it wrong. And they looked at the role of social media, online journalism and search engines in communicating complex information, communicating about science. So we know that social networks and social media have changed the way in which information is disseminated. There's cues about accuracy, the importance and popularity of particular bits of information, and they can influence how information's read, how many times something's been clicked on, how many times it's been tweeted, and where information was forwarded from can be more important than what the information is, and even the credentials of the people who produce that information. It's much more that transition through. If you think about online journalism, a lot of people get their information now from alternative media sources. They don't go to the traditional media at all. They focus on particular sites that they enjoy reading. We like information that confirms our biases, so we're much more likely, it's much easier for us to pick particular sites that we're comfortable with. So the alternative media is playing a bigger role in communicating about all sorts of things. Search engines, Google and information providers. If you think about algorithms and audience metrics, things like PageRank and meta tags, how often something's clicked on or how often something's referred to something else in terms of linkages. Surveys have shown that people trust Google to provide them with the most relevant sources. And I'm sure you've all of you have been in a situation where there's been a bit of a debate about an issue and somebody's done a Google search. So, you know, if you are used to going to credible sources for information, that might come into play. But, you know, the top 10 is what we look at. Okay, so thinking about those things, what's Google directing people to in terms of Fukushima radiation risk? When it happened, people are in an information-seeking frame of mind. Where are they being sent? I also want to talk a bit about citizen science and this whole idea of street science. Citizen science, some of you may know, is the idea of non-professional scientists or amateur scientists participating in scientific research of a peer review standard. So they're involved in the research, but the research will be conducted with an institution with the aim of some sort of peer review communication. Street science, which was a term coined by Jason Corbin, is this idea of non-professional scientists or amateur scientists being involved in conducting scientific research outside the laboratory to input into public debate. So very different reasons. Yeah? He talks about this sense that they feel the institutions have failed them, so they go outside the institutions to conduct their own research and input into that debate. So very different concepts. They're related, but we've got this sense that people want to engage in assessment of their own risk themselves. It makes people feel comfortable. And I think Sarah talked last week about risks are different in terms of how we perceive them. You mentioned H1N1 and heat events, how those things are communicated. So those unknown things, the things that are more where the risk is unknown to us, we want more of a sense of being able to assess that ourselves. So I wanted to give you some of that background before I went in and talked about some of the research that's been happening on Fukushima. Back to the whole idea of Google. Sharon Friedman, who's done a lot of work on how radiation risk is communicated in the media, she looked at 3 Mile Island and Chernobyl and also Fukushima now. She did a Google search in July 2011, so a few months after the Fukushima nuclear incident, you know, in March. And when she did a Google search, she found over 73,000 Google hits for the word Fukushima. She found over 22 million hits for the words Fukushima and radiation. She then did a Google News search. If you look on the right, you'll see her Google News search. So down the bottom, she did a search for Fukushima, 201,000 hits. Google News search for Fukushima radiation, 20,000. Now, I hope you can see that the Google News, the numbers on the right, the scale is the same as on the left. So it hardly even shows up in terms of news. So a lot of what we're seeing on the internet is not going through media channels, a lot of stuff that's out there. So, so she acknowledges, you know, traditional media outlets, web publications, government agencies, pro and anti-nuclear groups, and numerous experts on radiation issues all contributed to discussions of what was happening. But she actually doesn't look at this. This is a bit of an aside for her, that this is the first generation where the internet has played such a big role, but she focuses on media. So her paper is about the media representation of Fukushima. So all this stuff isn't being explored. And there's reasons why that. It's really hard to study internet communication. It's really vast. So even getting our head around how we might even explore this is difficult, and it's one thing that I've been struggling with. How do we even start cataloguing what we see and thinking about what people are exposed to when they're searching for information? So there's a new media researcher, Simon Cottle, who's had a go at mapping interactions between the Western corporate media and internet-based communication. And this really simplifies it, I think. Don't you think? Does it make it a bit easier? So he's had a go at looking at those links: traditional media, advocacy groups, social media, alternative media. But this is a really general model. He goes into it into detail, but it's a really general model, and it can't tell us much about how Fukushima was communicated on the internet specifically. But we can think about this in terms of the connections and the interconnections. If you think about it in terms of citation and the intercitation, what people are bringing into those conversations, what they're taking away, that's a way in which you can think about it. So the metaphor of ecology is a really nice one for this sort of work, because we can think about the interconnectedness within a system. So who was active, what were they saying, how might this be useful for thinking about communication, radiation risk to the public in the future? This is the sort of stuff we were interested in. So we decided to go in and have a look ourselves. So building on Sharon's work, we did a Google search and we put in the words Fukushima radiation risk in Canada. Now this was in December, so we're looking at the top 200 entries between March and December 2011. So those 10 months more or less after the Fukushima nuclear incident, to just get a sense of what had been circulating. What were the sites that Google was saying, this is what you should be looking at? We mapped it out according to month. So you can see here in terms of hits, so the bars are the number of hits. So in March, big spike, not surprisingly. This is where we get a lot of activities. Where it happened, people are talking about it. Then it drops off. You can see we get another spike in August. So this gives us some sense of how internet communication works in terms of it being based on events, event-driven in these ways in March, but we really don't know what's happening in August. So we decided to just start going in and looking at that. So then we mapped it according to who was speaking, who was actually creating this information that Google was then citing. So if you look here, total entries are still blue, the mainstream media is in red, and the alternative and independent media is in green. So you can see that the mainstream media in March, there's a spike. It's not everything, but we get a spike there in March for mainstream media, red, it drops down to nothing. Yeah, we don't get much more. But if you look at the alternative media, you can see, bit in March, yeah, drops down, but then we get another spike in August there. So we know something's going on later that perhaps we want to look at. Now, of course, this doesn't add up to 100%. If you added up the red and the green, you can see that it doesn't equal the blue. So we thought we'd go in and just focus now on March and August, since they seem to be the interesting months. We've done a lot of work in the other months, but you know, we've only got 45 minutes. So I'm going to focus on that for this presentation. So March, if we actually divide it up in terms of who was speaking, again, mainstream media is blue, so you can see in March that over half of those information packets, if we want to think about them those ways, in March were from mainstream media sources. Advocacy groups, alternative blogs and media, commercial, those lists are both the same at the, by the way, I just had difficulty, technological challenge sort of merging it together, so that's my best I could do. So both those lists are the same, but the point I want to make is if you look at August, you can see that mainstream media dropped right down, as we saw in the bar graph before, but we've got advocacy and alternative media and blogs making up the main chunk there. So we can't say much more than that, but you can see that there were other people speaking, commercial people trying to take, you know, water purifying tablets, all sorts of groups trying to take advantage of this. We had the energy industry speaking, federal government agencies, all sorts of people involved, but we could see where the bulk is. So we decided to go in and look a bit further at that. Okay, so March. March seems like a big jump. So the other thing we did is we went into March and actually mapped each day. So it started, I think, on the 11th of March, and then you can see there's a peak. This was around the 15th of March, and then we get another little peak towards the end of March. So we thought maybe we'd go in and explore that because, you know, March was such a big month. And we found that these were like 3 moments. So you can see I don't have a pointer here, unfortunately. So you can see March represents that small graph, yeah, graphed out, and then we've got a bit of a peak, and then we're going to... So we thought we'd just explore these 3 moments to see what was going on. So if you bear with me, I'm going to do a bit of a Simon Cottle and map out our first moment, which is in March, yeah, in a minute. So, okay, so 3 discourse events, that's what we'll call them. It's these 3 moments. So the first one was on that 15th of March, if you're thinking about these peaks. The Canadian PM states that Canada poses no radiation risk. No, the Canadian PM states that Fukushima poses no radiation risk to Canada. So he made that announcement, and it was picked up by a CBC article that went everywhere. We're talking about the interconnectedness. A lot of what we saw in that moment in March was people referring to that, among other things, but responding to that. There were also 877 public comments on that site, so we can look at this idea of a public response. People had difficulty looking at what is public communication, but on the internet, if you think about places where that are open for the public, they're inviting the public, and you get public comment, it's a place of public discourse. It becomes this place where they go. So first event, 15th of March. 28th of March, Simon Fraser University researchers announced elevated levels of iodine-131 in BC rainwater and seaweed samples. So that's our second moment. And this was, they actually posted that media release online. Lots of people commenting on that, interlinking to other sources, and we see public comment on that. Also, Vancouver Sun picked up that article, and we can look at the public comments there. So that seemed to be where the activity was happening around that time. On the 4th of August, Joyce Murray, Liberal MP for Quadra, states that Health Canada has been negligent in informing Canadians about Fukushima nuclear radiation threats. This was picked up by the Georgia Strait, yeah, and circulated all over the place. So we'll talk about that as well. It was ignored by the mainstream media for the most part, but that huge amount of traffic we see is instigated by this event. So as I said, I'm going to map out these events for you. I'll go slow with the first one, and then we'll talk a bit about that. So the Canadian Prime Minister, he announces at an unrelated media event, this was actually in Surrey, he was there talking about crime prevention, and somebody said, oh, tell us about Fukushima, this has happened. Oh, it's no problem. So he made that announcement there at another event. So this was picked up by the Canadian media, opinion and blog post, posted online. And we get this, our CBC News article. So this CBC News article contained this area for public comment, so we get this public input. So what I'm going to look at is where the public draws sources from, because the public cites a lot of information in their response to Harper's announcement of no risk. So, so also the online media article focused mostly on government communication. So from the BC government, talking about iodide tablets and no need to take those, and also stuff from the Canadian government. I won't spend a lot of time doing that, but the public comment was, while there was some comment from Canadian government and online news, and I can talk about that in more detail later, a lot of the information came from other sources. So medical professionals, talking about coming through their medical professionals from the an online statement coming from the BC government. US government, web pages, reports, the International Atomic Energy Association web pages, alternative media, yeah, which in turn referred to stuff that was in the Canadian media and also in the international media. The public also were looking at international media. This whole idea that our media aren't giving us the real truth, so we're going to other sorts of sources for that sort of, particularly the US and Australia, surprisingly. So interviews with the US Union of Concerned Scientists, so coming through the international media but also directly referring to their webpage. Street science, which I'll talk a bit about some more, but the radiation network that already exists. It's a street science network for monitoring radiation that some of you might know about. We also got some experts. You might be able to see that I've colour-coded this. So the black is government, blue is expert discourse, some sort of expert discourse, purple's alternative, green's media, and then we've got the red being the public. I hope those colours are the same. Can you see them? Colours good? Okay, so Wikipedia, good old Wikipedia, looking at what is iodine-131, what is cesium-137, looking at particular organisations that are coming out, trying to establish credibility for those organisations by showing they have Wikipedia entries, and industry. So there's a lot we could talk about this. We could spend the whole time talking about this, but the main point I want you to take away is you can see that all the arrows coming in from those sources are all pointing in the same direction. It's all the public. It's an information gathering phase. I'm pointing that out because the arrows are going to change in the next diagram, so I want that to be clear for you guys. So information gathering phase, we've got this thing of no risk. Is this true? How can we know this is true? Let's go and assess it. So lots of arrows coming in. Yeah, so public voice is drawing information from other sources and responding. Okay, our second event, remember, was the Simon Fraser Universities who announced that there were elevated, very minor, very small, but elevated levels of iodine-131 in Vancouver seaweed and seaweed samples and rainwater. So SFU, they produced an online media release and they actually had a media conference on that issue. This was picked up by the Canadian media, yeah, and you can see on the right there the Vancouver Sun article I'm talking about. Again, I'm not going to go through this whole diagram, but what I want to point out is these two-way arrows. In terms of the public inputting onto the SFU media site and also the Vancouver Sun article site, they're talking about places where members of the public can engage. Yeah, you can ring up this hotline, you can call up the expert question and answer. People are asking for particularly very specific bits of information that are affecting them personally, and they're trying to negotiate where they can find that information. So you can see that the media, to some extent, are providing that, those two-way mechanisms to them. A lot of comments, however, were about the frustration with the lack of contact with SFU researchers. I mean, let's face it, you know, it's not surprising. They're researchers, they've got work to do, but there was a lot of information posted on the SFU website about particular types of information, and I'll talk about that in a minute. But Metro Vancouver and Health Canada, you can see down the bottom, the same thing. If you go on those sites, you can see some frustration with public feeling that they've got particular concerns, nobody's getting back to them. So it's more in that engagement phase. You know, a couple of weeks have gone by, people have absorbed some information, now they want some specific content, very difficult to get. In terms of the specific content, requesting daily readings, results, follow-up testing. So saying to the SFU researchers, okay, you've done this work, what's happening now? What's going on? There was no follow-up on those readings. Information on safe, not safe levels of iodine-131, testing other supplies, coastal waters, food supplies, soil on dairy farms. This is where a lot of people were referring people back to the media sources, saying call up the hotline, find the, talk to the experts Q&A, get the information from there, because they weren't getting it. They weren't getting it from the official sources. So we see a lot of frustration being articulated on those public spaces about that lack of response from the experts. Okay, so I think that's the main thing I want to say about that phase. One of the organisations that was engaging, it wasn't direct one-on-one, but one of the, if we look at our Google hits, the BC Centre for Disease Control put out a frequently asked questions sheet, and it actually responded to some of the problems, to some of the concerns that were happening at the time. So instead of putting out this generic information, we get this sense of SFU researchers have reported finding radioactive iodine. Should I be concerned? No, it was expected that minute amounts would be of radioactivity. So it's this move to engagement, to actually keeping up with the conversation and inputting into the conversation, which is missing from a lot of those organisations. Okay, so moving on to August. So that was March. So if you look, you can see a lot of frustration over that lack of engagement. And then in March, Joyce Murray, MP for Quadra, UBC, she came out UBC way here. Yes, she came out with a statement that Health Canada had been negligent in communicating with the public. So this was picked up in the Georgia Strait. As I said, it was ignored mainly by the mainstream media, but it was picked up by the Georgia Strait in 2 of its articles, and there was a public response to that. So if we map this out, this is what an isocology map looks like. Okay, so again, I'm not going to go through everything, but we did get a big public response to what was going on, drawing information from other sources. But what I want to point out is in the actual media release itself, when the Georgia Strait published this article, they say in the article, we tried to contact SFU researchers, we tried to contact Health Canada about this story, we got nothing. So it's like an echo back to what we saw in moment 2, that public frustration being articulated in this article. So in some ways it's a validation, and then we can look at the public response to that announcement about the lack that we see. Yeah, and I think there's lots of things we can talk about, much more alternative information coming out, even the international media, much more of that sense of, you know, are our governments, you know, telling us the truth, all this sort of thing. But one thing I'd like to point out is this whole idea of street science. We get comments like this. So Mike says, I'm an independent filmmaker, I own HD camera equipment and a small 12-foot aluminium boat with a 6-horse motor. I edit on a camera. I'm looking for a scientist with a Geiger counter that can read all types of radiation to film a short documentary about whether there's a real threat or not. So Obi-Wan Speak responds to Mike, that's a great idea, and if you go on YouTube, you'll find many are already doing exactly the same thing. I do not think you need a scientist, but it would be nice. So we can see him move away from that expert discourse into this idea of street science. And if you go on the internet, you'll see a lot of these. Has everybody seen these Geiger counter videos? Yeah? What's really interesting, these are all from BC, Canada, you know, I think Okanagan or that area is about as far east as we go. So we see these Geiger counter videos, no faces, we just see the Geiger counter, somebody talking, and we'll get some sort of calibration of the Geiger counter. Lots of debate on these YouTube videos about whether they'd calibrated their Geiger counters correctly, and very technical. And then we get some sort of control measurement, then some sort of intervention, and then another reading. Sound familiar? This whole idea, scientific method? These are all over the place. Yeah? They were proliferating at the time. A lot of them are disappearing now because, you know, obviously the problem's not as big. But they weren't all saying that radiation was going up. There was a lot of people actually doing the testing to show there's no problem with radiation. It's actually okay, you know, our radiation levels are. So they're having this public debate based on their own measurements, yeah, trying to get some sense of assessment of risk themselves. Yeah, so they go on and on. Now, this happened to a larger extent in Japan, and some of you may know about this, the mapping mashups. So Jean-Claude Platane has written a paper about this recently, this whole idea of mapping mashups in Japan. Because of the lack of scientific data, or data that could be machine read, a lot of the data that the government were putting out was just PDFs, so people couldn't get the sense of a visualisation. They wanted a visualisation of what was happening in their area. So we see a lot of these mapping mashups where people have converted the existing government data, but wherever they can find it, to machine-readable formats and amalgamated it. So people with a lot of time on their hands. We also see a lot of, like Safecast, which have organised people, got a lot of money. They did a fundraising campaign for this street science public to get people to collect their own readings from Geiger counters and help input into these maps. So there's a number of ways, there's about 20 of these maps, or 20 of these organisations that were generating these maps at the time. And the day that Safecast came out, this is what Planton says, the day that Safecast came out with their maps was the day the government put out their own map of radiation reading. So he's speculating that this was, you know, that this street science actually prompted the government to, you know, produce their own maps, but we can't really know. But this sense of people trying to assess their own risk, you know, is something that we say. I'm going to hand over to Jackie in a minute, but what I'd like to talk about, and I haven't been able to talk about some of these things in this talk, but situations appearing to contribute to public efforts to fill radiation risk communication niches. So this niche this gap, this niche becomes apparent. People don't just ignore it. Bad data is better than no data. Yeah, so they will try to fill it. So, you know, a lack of data or publicly interpretable data, personal risk perceived, and a lack of control. I think Paul Slovic's been talking about this since 1987, the whole idea that, you know, risks that we have no control of, we want to try to manage that. History of perceived government deception, I haven't gone into some of those things. Chalk River, H1N1, bringing up all sorts of things. Misinformation on similar issues, ability to collect own data, that's new now. The ability to collect own data, network with like-minded people, and also the ability to create their own content. Yeah, that's new. So this is the situation we're in. So in terms of things to think about, I'll hand over to Jackie and I'll come back at the end. Oh, yes.
Inviting us. I'm going to do a little bit of a switch. Our macro findings, I'm going to zero in on some of our micro findings from the perspective of somebody in discourse analysis, in the field of discourse analysis. So you might get a little sense of what that looks like, or non-literary stylistics. So I won't bother trying to explain my field, but I think you'll get a little flavor of what it could bring to this sort of analysis of risk communication. So as we saw from Michelle's account of chains of citation in that lovely map, those lovely maps she's produced, the Internet affords participatory opportunities for the public that are not accounted for in unidirectional or one-way models of communication, models that suggest that we simply inform the public, transmit some information to them that they then absorb or or models that simply say involve the public but don't really articulate the specifics of that involvement. What does that look like? And as Michelle has suggested, if there's a gap, they'll involve themselves. And I think it's important to keep that in mind when talking about risk communication. So as Michelle has noted, the public's ability to collect data from a range of sources, to network with like-minded individuals, and to create informational content means that we need to better understand online citizen involvement, especially the participatory roles and activities this involvement entails. So to get a fuller picture of how this online citizen involvement works, we move from Michelle's bird's eye view, swooping down for a closer examination, a microanalysis, if you will, of some of the stylistic features we found on the comment threads. So I focus specifically on the comment threads for the most part. And these will help us to better understand the roles, activities, and attitudes toward information that we see in this online community. It's a little hard to assess attitude, but we can get a sense of what the sort of constructed or public sense of the information is that they're actually receiving, or how they're assessing that information. So I look at a number of stylistic features. A few of them I'm going to talk about today, and I won't bore you with too many of the details of what these entail. But I looked at them because this community, this online community, seems to be characterized by information broadly. So I wanted to look at features that specifically help me address these attitudes, perspectives, activities around information. So we choose to look at something about the epistemic, the features that would tell us something about the epistemic character of this community. Its treatment of knowledge, its knowledge producers and knowledge production or meaning making. So we look at a number of features called markers of certainty and markers of uncertainty. So I'm going to try to explain these. Markers of certainty would be existential there. So there are no indications with the verb of existence, the be verb are or is. It gives it a kind of fact-like status, the proposition of fact-like status. Agentless expressions, this isn't the best example I could have chosen, because primarily I look at agentless expressions that come from reports of speech, reports of others of speaking. So radiation rates were considered low. So who considers? Right? So the agent, the doer of the thought, in this case the consideration, is absent, deleted from the statement itself, and it gives it a kind of authority of consensus, because you can't attribute that statement or proposition to anyone. And this is a marker of uncertainty, epistemomodal expressions, and actually you see this quite a bit in scientific writing and in writing that comes out of art. So research writing uses a lot of epistemic modality. Rates might be too high. And these are expressions that encode speculation, estimation. You can hear it, right? So not rates are too high, but they might be too high. It's our tendency as researchers in our epistemic communities to be a little bit more cautious about the claims that we make. Okay, so noting that there's sort of lexical chains of words, that seem to cluster around certain ideas, around information. We looked at characteristic or thematic words, and these happen to involve words surrounding information, the term information itself. We also looked at directives or obligations, commands, because what we noticed was that posters on these comment threads were often directing each other, telling each other, guiding each other about how to participate on these threads, all centering around, of course, knowledge. So imperative structures, do your research. And deontic modal expressions, so this is another form of modality here. These encode sort of a norm authority. So we make estimations of what things, how we should do things, or what needs to be said, those sorts of things. Often that authority isn't attributed either, it just is. So you should come to seminar every class, right? So who says that and why? Why? It's a social obligation, larger social obligation. This is social. Epistemic modality has more to do with the knowledge, knowledge structures. So I'm going to throw out both of these. Maybe I won't. When looking at the CBC News report from the first instance in March, when the PM, Prime Minister Harper, announces that there's no risk to Canadians from Fukushima radiation, what I was really struck by were the uses of these sorts of existential their structures. And the article itself is 568 words, and there's 4 uses of them, of these structures, which is just, I won't use the word statistics for this audience, but that means there's a kind of intensity around that structure. So what's going on here, if we just parse this, I'm not going to spend too much time parsing it, but just that idea of the fact-like status of this proposition, there is no certainty, right? Absolute certainty. Okay. The other interesting bit, too, is that this information presumably comes from these officials, these agencies and departments, but it's not necessarily directly syntactically attributed to them. So again, it's floating on its own. Okay, so this is an instance of agentless expressive, an agentless expression. Radiation from Japan following the March 11th earthquake and tsunami is not expected to pose a safety risk to Canadians, Prime Minister Stephen Harper says. It's a little complicated because this is an instance of indirect speech. So presumably Stephen Harper said this, is not expected, but who isn't expecting it? It's not attributed to anyone. So it has that weight of authority, of consensus, giving it a certain status or a fact, almost fact-like status. So in the midst of all this certainty, however, we have uncertainty. Where does that uncertainty come from? Well, the uncertainty comes from the posters, from the 877 posters on this from this news thread. Here we see a lot of encoding of epistemic modality. It seems likely that. So it's a sort of language we might use as researchers, that radiation could do something. The Fukushima accident could affect a larger population, not does affect the larger population. And any waterborne radiation that hasn't dissipated might get here in 2 or 3 months. So what I'm seeing here in these sorts of statements is this idea that it's a kind of opening up of the certainty that we saw in the PM's statements, which keeps the discourse going, because this leads to certain activity, engagement, this knowledge-seeking, or sorry, this information-seeking activity that Michelle was talking about. So there's a lack of certainty in terms of on the part of posters, rather. Okay. And this certainty, lack of certainty, could be tied to this notion of concern or anxiety. So we're concerned, we're anxious, we're not going to have our concerns alleviated because we're still so uncertain. We're not believing the PM and his assertions or his certainty. But what's interesting, the point I want to make about this is that the online news reports frame their stories around public concern, public anxiety. So 9 mentions doesn't seem like a lot, but it actually is in this context. And this gets picked up, this concern, this framing concern, this sort of, we'll call it an affect framing or emotional framing of the news story itself around Fukushima, and explains to some extent the relevance of the article in the first place and makes it newsworthy then if the public is concerned. gets picked up certainly in the public comments. So you'll see a number of mentions of concern or fear or afraid or anxiousness or anxiety. What's interesting and telling is that most of these mentions happen in the first event after the PM articulates that there is no risk. And it probably drives to some extent certain kinds of activities, and these activities are around related word search that I did around look, find, and search. So there's concern, presumably, and then we go off to look and search for more information, to find more information. I'm looking at the time here, so I think you can see with, you see a lot of them talking in a kind of meta way about what they're doing. I did a search for this so-called quote and couldn't find anything. People need to go and search and read about this ASAP. Do something, look over reports of the past few days, and you'll find they've been dumping seawater. So it's all this activity presumably connected to fear. It drops off in the event number 2 after the SFU news release, and then picks up again after event number 3 or during event number 3. Now I could speculate that this has to do with, they're less interested in finding information than they are in the engagement. As Michelle pointed out, there was a lot of expression of frustration, of lack of engagement on the part of SFU scientists and others. So I think we could probably make some connection there. There's also, I just want to draw your attention to, we need proper research done, not only from government, but independent research as well. I'm going to come back to that because there seems to be a value around certain kinds of research and an idea of what proper research entails. Okay. So take 2, thematic wordings. Now, I expected to see wordings around concern and anxiety, right, given the situation. It's risk communication after all. Expected to see it. But what I didn't expect was the higher prevalence of words related to knowledge and information itself. They were much higher than anxiety, afraid, concern, etc. But interestingly enough, while the news reports frame their stories around affect, emotion, and not information and knowledge, it seems like the public is framing the issue around knowledge rather than fear. And this, I think, is really important for communicators to understand. And you can see the high numbers. And also, this connection between knowledge and authority is really key in terms of assessing that kind of, the particular information that they're receiving and that they're linking to. So I'll just let you take a look at that. So what we see then is not just, I'm going to make the claim, we're going to make the claim, that they're not just information seekers. They're not just information seekers. This isn't about informing the public who's seeking information and that they're passively absorbing that information. There's something much more dynamic, much more active going on. They have some agency in this community, as Michelle mapped out, actually. So they do a lot of assessing knowledge and expertise of each other, not just the sources, but of each other. And that's important, too, because that, in part, shapes the community and the ways of doing in that community, the sorts of activity one must do in that activity. So instead of trying to argue over a topic you clearly have no understanding of, why don't you actually go do some reading on the subject? There's calls for more peer-reviewed publications as references. So there's kind of, might be consoling, a kind of respect for research. And just because just because you say something doesn't make it true. So there are assessments of what are considered proper forms of knowledge on this site. I think this is my favorite quotation. You people need to calm down and science up. So it's this idea of directing knowledge activity. So we have here a community that tells each other at a meta level how to go on, how to be in this community. And in some ways then constructs the rules, the participatory rules and actions that should or shouldn't go on. So we see a lot of directives in the form of imperative structures, look, listen, and learn. And it's telling here that these are, this is more passive, less passive, more active learning, right? Or at least we like to see learning as an active process. And we'll just leave aside the actual source. And people should demand to know the real medical measurements and also take the time to learn what they mean. So, and I have tons of other examples. But these are social obligations. These are obligations of the community. And they help to some extent drive the community, and they shape the community in ways that Michelle has mapped out. So what can we learn then from the Fukushima nuclear incident? In terms of public risk assessment and the internet, I want to make a distinction to some extent between information and knowledge, because there seems to be a different idea circulating here. Certainly we can inform the public, give them information, but knowledge is something much more complex, as we know, because we're engaged in knowledge activities. This is what we do. So they also, the public, are also engaged in knowledge activity in the form of searching, assessing, calling for specific kinds of knowledge, directing public to knowledge, but also directing them in terms of how to read and assess these bits of knowledge. But they're also there's also meaning-making activity going on here. And in part, they're doing it through all of this stuff, but also through a street science, as Michelle pointed out. And they're treating knowledge in some ways like a scientist would, in the sense that we identify gaps or deficits in research, other people's research, and we attempt to fill them, I guess that's a simpler way to put it, in terms of with respect to our own research. They're doing the same things. Now, they don't have the same methodologies necessarily that we do. They don't have access to the same resources that we do, but they're doing their best. But the resources that they do have access to are the internet resources, as Michelle said, with the map mashing up. So they will take what's out there. So in terms of risk communication itself, one could argue that a better approach than the unidirectional, one-way informing of the public model that assumes a kind of passive recipient of that information would be a more dialogic approach, because I was going to say students, the public certainly, as Michelle points out, wants the engagement. They're calling for the engagement. So a more dialogic form of engagement might be beneficial. To be part of the conversation, to join the conversation, not necessarily manage it in the way that, say, Prime Minister Harper might have wanted to. I don't want to attribute motives on his part. Okay, so I'm going to leave it there. Michelle, you want to talk briefly about that? Okay.
Otherwise we've got to...
You can talk like this.
It'll be a little awkward, yeah, that's right. Oh yes, so the last point is just about citizen science versus street science. There's a lot of passionate, motivated, expert people out there who have a lot of time on their hands. So if we're thinking about lessons to be learned, how can we get them involved in more of this peer-reviewed type, work that's going to be useful, rather than feeling that they have to fill niches themselves. People have been talking for a very long time about public versus independent science assessments are trusted much more than we see in government. So how can we think about that for the future? There's us, just in case you didn't know.
Hi, my name is Anne-Marie, and I have a very similar area of research and interest, so it was great to see you on the roster for this week.
I saw you on the internet. You're the risk communication person here, aren't you?
I think I'm one of them.
Yes.
There's a few more now, but I had two comments. One, I was at the SFU meeting, both of them. There was one and then a year later, and what was very interesting there was the SFU was trying to educate the public about how we measure radiation and what it means. Yeah. And there was an incredible amount of hostility in the crowd aimed at the scientists. And I think that it stemmed out of just the sheer difficulty in understanding what we mean when we're measuring something to do with science, and particularly radiation in general. So I wonder if you had any comments on if there is anything in this research study that has something particular to do with the challenges around the difficulty of discussing all the different units and aspects that go into radiation as an example, other than chemical exposures, which tend to be a lot more simple.
I think it's like MIT was trying to do that whole idea about one size fits all. The problem is people have very specific concerns and very specific understandings, so it's not about that sense of, as a mass we'll communicate with you and understand. They want to know about their situation. So I think if there's one thing to take away, it's engagement at a smaller scale, having those mechanisms where people can And it's resource intensive, I know, but with such a complicated area, it's going to be very difficult to talk to people as a mass. They want different things, yeah, and they get frustrated when they're not getting it.
Very frustrated.
So, yeah, but there's a lot. I mean, the great thing is all those questions are there now. So, you know, we don't have to wait for a potential disaster to think about the types of things people want. People want to see maps. They want to zoom in on their area and just have a look at their rainwater or their catchment or their, I know CDC did some work on catchments in September, you know. People want that information. They want that earlier, you know. They want to visualise their own areas. I think that's my main point.
One other point was that your idea of the differentiation between what I call evidence and knowledge, right? The process by which facts or evidence become knowledge or wisdom. And I don't think it was just street science that was going on here, but we also saw the American government reporting facts that were different from the Japanese government's facts. And we also see this with air pollution in China as well. So it's not just citizens, but it's other agencies as well who have conflicting data that then is interpreted into wisdom and then projected for risk in the future. Yeah. So the issue is compounded by these other authority figures also having conflicting evidence leading to knowledge.
That's right. And we know those examples, other high-profile examples of controversial climate change, for example. As soon as there's controversy, people discount what they see. They decide there's no without consensus. We have no information to think about knowledge, so that's a problem.
What's interesting, sorry, I'm just going to pick up on that because you see the CBC News article presenting the information in terms of consensus, in terms of fact, but that wasn't good enough either, right? Because we have all this encoding of uncertainty afterwards. So, yeah, I don't know what the answer is. Maybe there's just a skeptical public, or part of the internet, or the use of the internet itself encourages the constant questioning because you can link, you can go all over the place on the internet. So, yeah, I think that it's just going to widen up and open things up rather than close things down. I'm guessing just the forum itself will produce that.
I just wanted to thank you for an excellent presentation, and I think it's very interesting the analogy you make with more common citizens having knowledge gaps and those gaps needing to be filled, and that perhaps stemming some of the misinformation or stopping the spread of misinformation. I just made me think of a recent news article that I read about the company Nestle that employs tons and tons and tons of resources to monitor every time the word Nestle is used in any form of media. And one can only think that that might be a future place for managing communications around these events. I just wonder if you could talk about any initiatives that you're aware of that are kind of maybe moving in that direction.
I'm sure BCCDC did media monitoring on Fukushima at the time. I'm sure Health Canada did. That media monitoring, I think, goes on all the time. But one of the things that isn't being monitored is what else is out there on the internet. So we've got an understanding of what's happening in the media world, but when it comes to you know, you can see the graphs in terms of where the activity was. It wasn't all generated or coming out of, you know, media discussion. So, you know, I'd suggest to wider. It's you know, we employ social media experts, you know, in government organisations now. So part of the role will be keeping up with that conversation, doing like the BCCDC did, and responding when they see things coming out. I mean, another, you know, they were talking about infant mortality and radiation. That was another issue that came out, as well as the SFU researchers. They responded to that straight away. So, yeah, keeping up with the conversation.
Yeah, I guess, would you agree with my assessment of Harper's declaration was that it was way premature, that the place was still on fire, nobody had any idea how much radiation was going to be emitted when he made that statement? And, yeah.
The main comment I'd make about that is that we don't work in a vacuum, and how our governments respond to previous incidents also reflects what happens in the future. So I think if that's the assessment that the public have, that was premature, if we see some sort of, the same sort of announcement in the future, when we know there was all that information from TEPCO later on coming out saying we actually don't have it under control, what does that mean for reading future events? So I'd say that's the major impact of making those statements, you know. Yeah. A lot of debate about whether he was the person who should speak. Why haven't we got Health Canada people coming out and speaking on this issue? Why have we got the Prime Minister? Some people are saying, fair enough, he's running the country. Let him letting other people saying, I want to hear from the researchers doing the work.
Well, yeah, from my years of experience watching Health Canada and listening for anything informative from them, you get a lot of silence. And I have personally known of good research they did that was never made public. It was stamped top secret because, for whatever reasons. So, yeah.
I'm still waiting for that report from Health Canada. Has anybody got a copy?
You'll probably never see it, but they have a lot of reports that are never on the web. I wanted to get your comments on something. I actually got involved in some communication very early in the incident. First of all, I want to say what you're doing is great because this whole thing has been fascinating, not really from a science perspective, but from the public response, risk perception perspective. And I think this is going to go on. This is going to be a classic. So what you're doing is great. But one of the things I sensed very early on in the incident was that there was silence. And actually that's why I started responding, because nobody was saying anything. And I guess my feeling was that actually if government officials had said anything at the time, that may have calmed this whole other conversation. And I just wondered if there was anything you saw to get that sense, if this sort of alternative conversations, the blogging was in a response to an information void, and do you think that actually that could have been blunted by very early response, just to say, you know, we're following this? I mean, you don't have to say this is good or bad.
Yeah, I don't know if it would have stopped the conversation, but it may have stopped the trajectory of the conversation, especially when announces no risk with such certainty, and then you have a skeptical public. So there we go. On that particular comment thread of 877 comments, many of the posters did mention that they wanted to hear from other sources. So had the government not, as I think Michelle just mentioned this, had the government not, or had Prime Minister Harper, who I think at the time was involved in an election or during an election cycle. So there was a lot of commentary around politics itself rather than the actual incident. So it got muddied. So that was one of the problems. But yeah, they were calling for information from Health Canada, from scientists. They wanted to hear from from experts in the field of radiation. And so and because there was the gap there, it started the projection of information seeking, and then a certain kind of participation on these forums around the whole idea of knowledge and knowledge making. Yeah. So yeah, I'm thinking maybe, hesitantly, maybe, I'd say.
Just briefly, people were very interested in Stephen Harper's science credentials as well. They wanted to see those, being able to speak on this issue.
The idea of authority and expertise is a major theme in all three instances. Yeah.
Right. It is 1:30. Should we sign off the web portion of the broadcast at least? Thanks again very much, ladies, for an excellent analysis.
Pleasure to be here.